The term Amchi designates the practitioner of the science of healing in the Ladakh region of the Indian Himalayas. An Amchi travels extensively into the interiors of Ladakh.
We have a group of 10 nuns who are trained as a Amchi. Those are the traditional medical practitioners, and they give treatment in the villages and the nunneries. And same time they help many of the women and children to take care of the health and the hygiene, introducing about the basic life facilities based on the Buddhist thought.
They bring relief through traditional means to villages and populations living in isolated areas. We derive our inspiration to follow these Amchis into those places where the face of care is seldom seen. In August 2012, interns from Manipal University College of Dental Sciences, in collaboration with the European Dental Students Association and Wisdomtooth, a healthcare foundation based in Washington, USA, conducted an outreach mission in Ladakh district of Jammu and Kashmir, India. The mission, titled Amchi Project, was a multinational effort involving 44 doctors, dentists, interns and dental students from 3 continents involving 14 nationalities.
6 o'clock in the morning, we're about to head to one of our outreach projects. Everyone is getting ready, getting into the bus. We just had breakfast. We're all very excited, have no idea what to expect. Hopefully there will be a lot of patients, a lot of people to help.
The project aimed at taking into consideration multiple aspects, which included direct care and investigating the existing and previous disease patterns.
Here in Ladakh, we know that they suffer from quite bad fluorosis. And so basically to combat that, we are examining 2 villages, Panamik and Chushut, and examining all the villages for levels of fluorosis by doing health checks, asking questions, and also checking for systemic fluorosis. We can then take water samples from all of these houses, and for the first time ever, we have the ability to check the level of fluoride in the water. And this is actually thanks to a very generous donation by a company called Palin Test, who have gifted us a photometer 7500, which is a really, really accurate piece of equipment that can immediately test the fluoride level on the spot.
Sustainable development of local manpower to enhance the existing healthcare system by training local dental providers, nurses, and most importantly, the Amchis. Traditional nuns of Ladakh who travel throughout the region, providing both spiritual as well as medical relief to the people of Ladakh.
You see, he has a filling here. You see, this is not tooth. Yes. You go through it here, all the way, and you use your headlamp or whatever you have to see, like, this is dark, now it's light. And you can easily see like this. And then for the inside, you can use the mirror. It's going to switch hands. To see the inside as well. Because you need to see everything, especially for the lower jaw, like the front teeth here. Usually here, a lot of calculus gathers. So you check for that as well. And all the way here.
The mission lasted over a period of 9 days. The mission involved multiple groups of volunteers working at schools and hospitals in Leh and simultaneously outreaching outlying remote areas of Tangse and Panamik.
We have been to 2 different places. The capital where we're working today is Leh, and we see a lot of early childhood caries. We have those cute, beautiful kids coming in, and the caries situation is terrible. Out of 20 baby teeth, you can see 20 decayed ones. And the little older one, we see a lot of lost first permanent molars. They are extracted, probably also due to caries. And what we try to do here today is we screen the kids and we give as many as possible treatment. But that's what we can do today. For the future, it's my hope that we will have a plan for oral health education for teachers, for the children of course, and for their parents. I hope that the government will provide some program for the schools. One idea is to have them brush their teeth every morning with fluoride toothpaste. I think just that will help a lot, and try to educate them to understand the connection between caries, toothbrushing, and the diet.
Residents were screened for both medical and dental problems. Screening of locally prevalent diseases such as rheumatic heart disease, hepatitis B, and skin infections were carried out by the volunteer team.
We have been treating the patients since last 1 week. In the first 3 days in the S&M hospital, around 600 patients were treated for the restorations, scaling and extractions. And as a part of the project, we are doing now the school health program, in which 4 schools we are concentrating. So 2 schools we are already finished, and 1 more school today we are concentrating on basically on the kindergarten children, not the very adolescent children, because our idea is to, if you intercept the disease, dental disease, or preventive measures if can be taken at the early ages, that will give more beneficial effect than treating the adolescent patients.
Responsibility for safety and emergency medical situations were undertaken by the respective medical personnel. Before every outreaching mission, the departing team was briefed on performing basic emergency protocols. Owing to the high altitude of the region, it was seen that medications were administered to the volunteers suffering from altitude sickness.
You know, this Leh is the capital of Ladakh. We have 5 blocks: Nubra, Khalse, Leh, Tangse, Nyuma. Okay. Then, though the population is very less, around 1,16,000, around like this. The area is so large, you see. It is a scattered area of around 45,000 square kilometers, you see. It is very difficult us, the medical personnel, to cover all the villages, all the areas you see. So through these organizations, NGOs, we can go to those remotest areas, you see, because we have a shortage of manpower, shortage of everything, you see, shortage of equipments, machinery equipments. So through NGOs, we can be approach to those remotest areas, you see, through NGOs.
Amchi has now evolved into a program with multinational teams coming in on a biannual basis to help train the local medical providers, find solutions, and continue investigating local health issues and provide direct care while they are there.
We are here in one of the most remote parts of not only India but also the world. So there's hardly any dental care. Most of the patients whom we have seen till now have never seen a dentist in their life. So that speaks a lot about the kind of dental care they have been receiving. Because in a place like this, once you get a dental problem like a caries or a periodontal disease, it is very difficult to treat because there is not much of care available. So the emphasis here should be on prevention, and that's what we are doing here. We are making sure that we inculcate the good oral hygiene practices among the students, and hopefully they never have to visit a dentist in their lifetime, since the prevention is always better than cure, and that is the motto of our project at this time.
This is the first such venture from the students of dental college, and I wish the team the very best. They have learned quite a bit in this exercise so far, and there's so much more to learn. Let them have fun, see new parts of India, make friends with students from across the world, and carry the collaboration forward.
On the whole, I can say that the students must have developed both professionally as well as personally by interacting with the students of other universities.
The program strongly believes in Wisdomtooth's motto, "Give a man a fish and he can eat for a day. Teach him how to fish and he can eat for a lifetime."
Season rise when I gave the word. Now in the morning I sleep alone. Sweep the streets I used to own. Shum 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 shum.
Gule. So, what were we talking about? It's gonna have to be edited, isn't it?
My enemy's eyes, listen as the crowd would sing. Now the old king is dead, long live the king. One minute I held the key, next the walls would close on me, and I discovered that my castle stands upon pillars of salt and pillars of sand. I hear Jerusalem bells ringing, Roman cavalry choirs are singing. Missionaries in a foreign field, and for some reason I can't explain. Once you gone, there was never an honest word, and that was when I ruled the world.
Malaysia. Right. Indian origin. Yes. So actually you are Indian. Yes.